Well, in my specialty in urology, it is basically the same as in other open surgeries. We require very good lighting in order to see all aspects of the field. It should not be too bright, it should not be too low. It should have a good contrast in order to differentiate the tissue planes from each other and have a good working environment for us as surgeons, but also for the anesthesiologists and for the nurses involved in the surgery. There are some aspects that is important, and let me give you some examples and a handful of examples for light, what is important. One is the adjustability. You need to move the light. You need to move the light towards a specific area in the body, in the field you're operating. This requires at best brightness, but also an adjustable brightness. Also, the color of the light should not be too light, it should not be too dark, so it needs to have some warm color. And with the adjustability and the steering of the light, aside the heat prevention, so if you are working in an OR environment, in an operating theater, you move a lot, you are wrapped with your sterile equipment and the patient is heated, so additional heat should also be avoided. Those are some factors which are very important in the light equipment in the OR operating theater. Sterility is something we deal with every day, and so it needs to be cleaned easily by the cleaning personnel on the one aspect. On the other hand, it needs to be operated easily with, for example, sterile cuffs to move, because we as surgeons need to touch the light, we need to adjust the light. Aside, shadow reduction would help a lot. If we have shadows, it's hard to differentiate the tissue planes. So this is something what helps us as surgeons to have clear-cut light without a lot of shadows.
For the surgeons, it's extremely important to have excellent OR lights so that they can better detect the tissue structures and conduct surgeries smoothly and more easily. Surgical lights need to be easy to move and position and to provide shadow-free light. Apart from that, the light settings must be easy for the surgeon to adjust intuitively so that they have optimal light on the wound field at all times.
In addition to providing an intuitive control interface, surgical lights may also have features that automatically adjust the light based on the surgical field's characteristics. Let me give you an example. Some lights may use sensors to detect the position of the surgical team hands and automatically adjust the lighting to reduce the shadows and improve the visibility. Overall, intuitive control of surgical lights is an essential feature that can help the surgical team to conduct the procedure more easily and safely, improving workflow, efficacy, and surgical precision. The surgical light control interface should be designed to be user-friendly and responsive, allowing the surgical team to adjust the lighting without disrupting the surgical workflow. Aside, including a camera and transferring the image to a monitor might make sense for educational purposes.